Each intercostal space contains one posterior intercostal artery with its collateral branch and two anterior intercostal arteries. The greater part of the space is supplied by the posterior intercostal arteries. Now, the posterior intercostal artery, they are 11 in number, one on each side in each space. The first and the second posterior intercostal arteries arise from the superior intercostal artery, which is a branch of the costocervical trunk of the subclavian artery. The first and the second posterior intercostal artery. The third to 11th arise from the descending thoracic aorta. The right-sided arteries are longer than those of the left side of aorta. The course and relation you can see in front of the vertebra. The right posterior intercostal arteries are longer than the left and pass behind the esophagus, behind it, the thoracic duct and the azygous vein. This is the azygous vein and the sympathetic chain as well. They are all running posterior to it. Now, on the left side, the left posterior intercostal arteries are passing behind. This is the hemiazygous vein and this is the sympathetic chain. They are passing behind it. Course and relation in the intercostal space, the artery is accompanied by the intercostal vein and the nerve, and relationship from above downwards is vein, artery, nerve. The neurovascular bundle runs forwards in the intercostal groove, first between the pleura and the internal intercostal membrane, then between the internal intercostal and the intercostalis intima muscles. Termination. Each posterior intercostal artery ends at the level of the costochondral junction, anastomosing with the upper anterior intercostal artery of the space. Branches. The dorsal branch here supply the muscle. This is the medial dorsal branch, supply the muscles and the skin of the back, gives off a spinal branch to the spinal cord and the vertebrae. A collateral branch arises near the angle of the rib, descends to the upper border of the lower rib and ends by anastomosing with the lower anterior intercostal artery of the space. Branches. The muscular arteries are given off in the intercostal muscles, the pectoral muscles and the serratus anterior. The lateral cutaneous branch accompanies the nerve of the same name. Mammary branches are arising from the second, third and the fourth arteries and supply the mammary gland. The right bronchial artery arises from the right third posterior intercostal artery. The anterior intercostal arteries. There are 9 intercostal spaces anteriorly, so as there are only 10 ribs each in front of the body, there are 2 anterior intercostal arteries in each space. In the upper 6 spaces, they arise from the internal thoracic artery. 7 to 9 space, the arteries are branches of the musculophrenic artery. 2 anterior intercostal arteries end at the costochondral junction by anastomosing with the respective posterior intercostal arteries and with the collateral branch of the posterior intercostal artery. The intercostal veins. There are two intercostal veins in each upper 9 spaces. They accompany the corresponding arteries. In the upper 3 spaces, the veins end in the internal thoracic vein. In 4 to 6 spaces, the veins end in vena comitans accompanying the internal thoracic artery. In the succeeding spaces, they end in the venae comitans accompanying the musculophrenic artery. There is one posterior intercostal vein and one collateral vein in each intercostal space. Each vein accompanies the corresponding artery and lies superior to the artery. The tributaries of these veins correspond to the branches of the arteries. They include the veins from the vertebral canal, the vertebral venous plexus, and the muscles of the back and the skin. Veins accompanying the collateral branch of the artery drain into the posterior intercostal vein. The mode of termination of the posterior intercostal vein is different on the right and on the left side. How? Now, on the right side, first, second, third. First, drain into the right brachiocephalic vein. On the left, again, drain into the left brachiocephalic vein. Whereas the second, third, and fourth join to form the right superior intercostal vein, which drained into the azygous vein, whereas they join to form left superior intercostal vein, which drains into the left brachiocephalic vein. Fifth to eighth in the azygous vein, on the left side the accessory hemiazygous vein. 9 to 11th and subcostal in the azygous vein, and on the left side into the hemiazygous vein. Lymphatics. Lymphatics from the anterior part of the space pass to the anterior intercostal or the internal mammary nodes, which lie along the internal thoracic artery. Their efferents unite with those of the tracheobronchial and the brachiocephalic nodes to form the bronchomediastinal trunk, which joins the right lymphatic trunk on the right side and the thoracic duct on the left side. Lymphatics from the posterior part of the space pass to the posterior intercostal nodes, which lie on the heads of the necks of the rib. Their efferents in the lower 4 spaces unite to form a trunk, descends and opens into the cisterna chyli. The efferents from the upper spaces drain into the left bronchomediastinal lymph nodes on the left side and into the right bronchomediastinal lymph nodes on the right side. Coming to one important artery, which is the internal thoracic artery. Here, this is arising from the inferior aspect of the first part of the subclavian artery opposite the thyrocervical trunk. The origin lies 2 cm above the sternal end of the clavicle. Internal thoracic artery rises from the lower border of the first part of the subclavian artery, descends medially and downwards behind the sternal end of the clavicle and the first costal cartilage, runs vertically downwards 2 cm from the lateral border of the sternum till the 6th intercostal space. After the artery terminates in the 6th intercostal space by dividing into the superior epigastric and the musculophrenic artery, the artery is accompanied by 2 venae comitants which unite at the level of the 4th costal cartilage to form the internal thoracic or the internal mammary vein. The vein runs upwards along the middle side of the artery to end in the brachiocephalic vein in the inlet of the thorax. A chain of lymph nodes lie along this artery. Relations: above the first costal cartilage, it runs downwards, forward and medially, behind number 1. The sternal end of the clavicle, the internal jugular vein, brachiocephalic vein, first costal cartilage, the phrenic nerve. It descends in front of the cervical pleura. Branches: the pericardiophenic artery, right, arises in the root of the neck and accompanies the phrenic nerve to reach the diaphragm, supplying the pericardium and the pleura. The mediastinal arteries are small, irregular branches that supply the thymus in front of the pericardium and the fat in the mediastinum. 2 anterior intercostal arteries are given to each upper 6 intercostal space. The perforating branches accompany the anterior cutaneous nerves. In the female, the perforating branches in the second, third, and fourth space are large and are supplying the breast. The superior epigastric artery runs downwards behind the 7th costal cartilage and enters the rectus sheath by passing between the sternal and the costal slopes of the diaphragm. The muscular phrenic artery runs downward and laterally behind the 7th, 8th, and 9th costal cartilage, giving off 2 anterior intercostal branches to each of the 3 spaces. It perforates the diaphragm near the 9th costal cartilage and terminates by anastomosing with the arteries on the undersurface of the diaphragm. Note that through its various branches, the internal thoracic artery supplies the abdominal walls from the clavicle to the umbilicus.